Hi, I'm Taylor, and this is my overall J1 clinical experience. So, what did I learn? I learned so much about communication and talking to patients and just doing our basic clinical skills, which was really interesting, and I loved every second of it. So, what skills did I perform? I performed lots of like setting up the IV pole, changing the dressing on an IV site, basic like care of a patient, like changing them, washing them, which was all really fun. Even though a little gross at times, it definitely was a big blast for me as someone who really does want to go into this fair and field and really wants to like take care of patients. Um, and so, how will I apply these skills that I learned? So, one of the biggest ones is communication with the person because being in a hospital is such a hard time for not just the patient, but everyone there, like the family. So, communication with both the patient and the family has been such a great skill that I can use outside of nursing as well. Communicating with my friends and family is such a big thing. And as well as just the regular clinical skills like doing an IV and passing medication and IV pulse setup, all of that is going to help me as I progress through the program. And just doing these skills and a basic assessment is so huge, and you can use that outside of the hospital. Just make sure that you're okay. You can do these skills on yourself. So what do I believe went well? I believe my basic communication after the first interaction usually goes really well. I communicate with the patients, the family, and make them feel welcomed and that they shouldn't be afraid of the hospital. And I also think I do really well of trying to make sure I walk around the unit and not just sit at the nurses station the entire time, because I'm not just there to sit down and talk to people at the nurses station. I'm there to walk around and learn. So that's one of my biggest things is I walk around and learn and try to do as much as I can. I answer a call immediately when it pops up. I go and check on the patients. I round with my patients. I make sure they don't need anything on an hourly basis like I'm supposed to. I make sure that everyone is taken care of. One thing that I could improve on though is my first communication with them. I'm very shy at the beginning. It's because it's 7 a.m., but I do try to communicate with my patients throughout the entire time. Another thing is asking to do more. I definitely try to do as much as I can, but definitely that first interaction when they have the first medication pass where all of those injections are starting to be done, I don't. Because, like, if they get long acting insulin, they might not need insulin for the rest of the day. So, having my asking to do those skills will definitely help me as I improve and go along through nursing school. And another thing that my nurse always said is time management. You can always get better at time management. How did clinical setting overall enhance my nursing education? It really helped me really justify that I really do want to be here and that this is really something I want to do with my future, because I just loved interacting with the patients, the nurses, the PCAs, the cleaning crew. Those people are saints. I love those people. It was such a good time, and I just loved learning all the skills, putting those skills to use, and making sure that I learn as much as I possibly can about nursing and doing these skills so that I'm prepared for the future. Um, I have so much to say about all of the nurses that I talked to. They were so helpful. They really did want to teach me. They did not want to leave me behind. I followed them and I would leave them and I would come back and see if they needed anything. When they were sitting at the nurses station doing charting, I would ask questions or I would walk around the unit to make sure none of the patients needed anything. And as far as I can tell, based on comments that Professor Beebe has left me, that a lot of my professors really did, or nurses really did like having me there, which really did warm my heart that I really do think that I am in the place that I need to be. But all of my nurses were great. Some of my favorite units were going to be neuro and respiratory, probably because there's always something going on in those units, and that's really what I want to do, is something that I'm not sitting down, because those were kind of the units that I wasn't the best or thriving on. But overall, I had a great clinical experience and really wish that I could have Miss Beebe as my professor again. She was real helpful, and that I continue to stay at St. Luke's because they really have improved my experience overall for nursing school. Thank you, and again, thank y'all so much.